My name is Matt Tuff. I am a solicitor in the Major Trauma Service at Moore Barlow Solicitors and an accredited senior litigator with the Association of Personal Injury Lawyers. Today I'm going to be talking to you about the importance of getting rehabilitation or treatment for claimants at as early a stage as possible. Of course, achieving a fair sum of compensation is really important. However, equally important in my view is getting treatment for people as soon as we can. The most important thing is your health, and the earlier a person can have treatment, the better the chance of a good outcome. Now, treatment can include physiotherapy, occupational therapy. It can include counselling where a person suffered trauma and psychological injuries. In the case of a brain injury, it can include neuropsychology, speech and language therapy. We also look at whether people may need equipment or adaptations to cope with their injuries, or input from a support worker or carer. Now, the way all this works is that at the very start of a case, as soon as we are instructed, we will write to the defendant's insurance company asking them to let us know as soon as possible whether they will consider providing funds for the client to have treatment. It is voluntary, but in our experience, most insurance companies do agree. Once they do, we then arrange for someone called a rehabilitation manager to go out and visit the injured person either at hospital or at home as soon as possible to assess what treatment they need in the short term and what equipment. They'll then prepare a report setting out what they believe the client needs and what the costs of it are, and we'll then ask the insurance company to confirm that they will fund that treatment and equipment and so forth. Now, there's something called the Rehabilitation Code 2015. This is a voluntary code that many insurance companies and claimants law firms, including Moore Barlow, have signed up to. In fact, Trevor Sterling, who is the head of our department, the Major Trauma Service, was actually one of the people who helped to write this code. Now, this code encourages both sides to look at providing treatment as soon as possible. One particular advantage of having rehabilitation or treatment provided under this system is that the insurance company pay for the cost of the treatment on top of the compensation that the injured person gets at the end of the case. The cost of that treatment is not taken out of their compensation at the end. Now, one very unusual point about our department, the Major Trauma Service, which distinguishes us from many other firms, is that we have our own in-house rehabilitation coordinator. She's someone called Salisbury. She's a very experienced worker with rehabilitation. She used to be a trauma physiotherapist at the Major Trauma Centre, St George's Hospital. She provides a great deal of help. She helps to monitor, provide quality control for the different rehabilitation companies we use. She can provide advice on reports that are received. And in those rare cases where the defendant insurance company does not agree to provide rehabilitation, she's very experienced in helping to provide and access for people NHS treatment. We work very closely with a number of NHS major trauma centre hospitals, including St George's Hospital and King's College Hospital, and they refer patients to us in the knowledge that not only are we experts in getting all the compensation that a patient is entitled to, but that we are passionate about getting rehabilitation for all of our clients. This passion for getting rehabilitation for people as early as possible is what distinguishes us from many other law firms. If you have any questions or want any more information on this, please don't hesitate to get in touch with me, Matthew Tuff, at Moore Barlow Solicitors.